Assalamu alaikum lovely viewers. Ina muku marhaba zuwa kan shiri mai suna Healthy Life, Rayuwa Mai Lafiya. Last week mun fira kan topic da bature ke ce mai frailty in old age. A yayin da mutum ke rauni yana girma. Mun fira game da what frailty itself is and causes, symptoms and also potential health complications da kuma impact of frailty. Zaka iya ka samu previous discussion insha Allah wanda muka yi wancan mako kan social media handles mu by searching Bina TV on Facebook and YouTube insha Allah. Ni mai gabatar da shiri favorite telenet ku Nana Amina Muhammad. To wa'anda ke dokan nauyin shirin mu City Physiotherapy and Rehabilitation Center wa'anda ke kasuwa opposite UMB Bank. You can connect with them on 0269 782200 0269 782200 da kuma 0596 036499 0596 036499. Suna yin both home service da kuma suna ya su admit patients su aje shi hospital su mana clinic inda suke aiki su duba shi when it comes to machine nan na da spinal cord injury or stroke. They do admit the person daga clinic su so ba shi treatment mai kama lalle yanda ya kamata. Or they do home service. They do come to your comfort zone to give you the best therapy ever. So look no further by City Physiotherapy and Rehabilitation Center. To bakona wanda ni da shi za mu fira PT Misbah, Deputy Chief Physiotherapy wanda ya fito Kwalebu Teaching Hospital da kuma shine CEO City Physiotherapy and Rehabilitation Center. We will go for a quick commercial break and we'll be right back. Assalamu alaikum.
It is hard taking care of your loved ones after stroke or other neurological conditions such as spinal cord injury. It's even harder carrying them for therapy every day. So, why not let us take that burden off your shoulders? At City Physiotherapy and Rehabilitation Center, we offer a one-stop nursing and physiotherapy care at our state-of-the-art facility. Whether it's stroke rehabilitation, physiotherapy, sports injuries, massage therapy, pediatric rehabilitation, acupuncture, or chronic neck and back pain, City Physiotherapy and Rehab Center is your answer. Our caring, committed, and passionate therapists, nurses, and administrative staff are always on call to give you an excellent and quality health care towards recovery. You can find City Physiotherapy and Rehabilitation Center at Kaswa 2nd, just opposite the UMB Bank. You can also call us on 0269 782 200 or 0503 403 263 or 0596 036 499. At City Physiotherapy and Rehabilitation Center, you come in a wheelchair, you go back home walking. City Physiotherapy and Rehabilitation Center.
Relieve pain, restore function.
To masu kallo a barkanmu da dawowa. Kamar da na ce muku topic mu wanda namu discuss yau frailty in old age. A yayin da mutum ke rauni yana girma, wani ma ka gan ya tun yana rauni tun girma bai shiga ba. Ba hakan kawai bane, akwai matsala inda ka gan mutum ejin shi bai yi nisa ba kuma yana rauni. Batun da za mu yi kenan. Amma yau za mu continue ni kamar da na faɗi muku mun tun samu previous discussion wanda muka discuss what frailty is, causes, symptoms, potential health complications da kuma impact of frailty. Yau za mu shiga cikin other questions mu yaso mu end topic of she frailty in old age. Da shi bako na PT Miss Bao, Deputy Chief ne na Physiotherapy daga Kwalebu Teaching Hospital da kuma shine CEO City Physiotherapy and Rehabilitation Center. Tare da ni mai gabatar da shiri favorite talent kuna na Amina Muhammad. Healthy Life. Rayuwa Mai Lafiya. Welcome da zuwa. To da mu shiga cikin questions mu inda muka say last week, inshallah da mu continue. Da mu fira game da assessment and diagnosis. Is there any method ko tools da za ya use assess frailty in old aging now?
Okay, so assalamu alaikum warahmatullahi wabarakatuh. Ina son gaida masu duban mu da gida da koina, kuma ina son gaida da staff in City Physiotherapy and Rehabilitation Center. Kamar da na faɗi muna kasuwa opposite Pink Cafe. Tools and diagnosis. Usually in the mishi kagan relative kagan kamar there are signs of symptoms of frailty. Kamar da muka for the chicken last program akwai assessment tools. Actually assessment tools kaman they one up they kaman questionnaire. The doctor usually maybe geriatricians so ne doctors in the ke duban masu wanda suka yi girma, you know, suka yi girma. Akwai assessment to questionnaires in the dasu based on that so at a tambaya wadansu questions so wadansu functional tests shi a gane kama okay me shi na go into frailty. Amma banda wannan kuma nan a few things in the ke da kanka da ka gan kaman gan kaman maybe the person is becoming frail is kaman for example in da me shi in dai tashi cikin kujera bai ya tashi shi ya kama abu sannan ya tashi. Shi sa usually suna sa standard kaman inda kaya ka saya ka zauna kaman 5 times. Inda kaya ka you are not frail amma inda ba ka yi shi dai ka kama abu sannan ka yi ka zauna ka tashi kaman 5 times means ba ka kai 5, so that means akwai frailty is setting in. That's one sign.
I understand.
Another one kuma ne mishi bai tafiya da sauri.
Okay.
Ka gani with time na ka gani tafiyan shi yayi very slow.
So there are some of the like
signs
method in
exactly exactly. So, because in terms of maybe looking at the diagnosis, this diagnosis can be done by a trained health person. But before I mean yazo ya kai wurin trained health person ke kuma nan the observer, the caregiver, those are some of the things in the kamata ka gani. Sannan kuma maybe wurin mantuwa kuma kagan mantuwa na zuwa diwa, or maybe mishi na a bit disoriented. A bit disoriented, that's also part of it. Another signs and symptoms for that kind of do can diagnose. Suddenly, me lose weight. Lose weight like, over let's say.
I'm talking of the method, the tools, and then the daya I use, I assess no wanganga frailty asset into Rayuwa system shi. Shi nake so mu yi magana kai. So muka je cikin method nan kaman da mu koma cikin firan mu. Okay. So cikin method nan kai batun kaman aya tambaye me shi wasu questions kaman wani irin questions kaga kaman za ya tambaye me sha gane kaman frailty asset or not.
Okay. She said I ask for method and tools is in a chicken part of the general assessment.
Okay.
Part of the general assessment. Mishi yazo na gabanka ya ka ganshi ya lafiyan shi ke, how does it look by itself, ya tafiyan shi ake, because all of these things are part of the methods and assessment. Because part of the methods and assessment in the ka bar me shi tafiya duba ya tafiyan shi ke, ka tambaye questions the caregiver ya yake, ka tambaye question the caregiver me shi yana yi juya ma cikin gado. That's part of the methods of the assessment. Ka tambaye kuma ina ya tashi ya zauna gado cikin gado shi da kanshi, ba wai shi ya ce ku zo ku kama ni in tashi in zauna ba.
So she caregiver, and these are some of the questions
because these are some of the, those are part of the subjective questions that can tambe caregiver and even the subjects, the patient as well. That can tambe shi kana ya kai aka ya yake ya rayuwan shi yake ya wurin kwanciyar shi yake shi da kanshi yana yi ma jikin shi wanka. You know, those are some of the things that ina cire kayan jikin shi ya sa ma kanshi kayan jiki yayi tafiya je kusfa shi da kanshi. Inda tafiyan na ana kama shi ne when distance yake ya tafiya in tafiya kadan yana gajiya. Those are some of the methods and assessments. These are all of these questions are in the questionnaires in the health practitioner. They tatambaya. She said they tatambaya all of these questions and then she come to a conclusion kama wanga frailty ya fara set in, ko frailty be fara set in based on all of these things that he looks at.
Okay. No. So how can family members that are caregivers and that's who to detect are being very early?
Family members and caregivers yakmat very observant. Me shi ya fara ya sunan shi girma ke kake zama da me shi ka san ability shi aka ce oh ya sunan shi da yana ya tashi kami shi da kanshi yana tashi yana yin kanshi komi ya tashi wankan shi ya ci abi ya sunan shi ya shirin ya wuce masallacin shi ya koma ma yanzu kamin yayi wanga harakokin duka ina slow be ko kuwa be ko kuwa da me shi da kanshi in kamin dai tashi ya fita ya je ya sunan shi ya shiga kusfa ya je boli yana yi shi da kanshi amma yanzu shi dai ya kira an tanye shi sannan. Those are some of the signs and some of the symptoms sa da kaman ya sunan shi those weaknesses ya fa. What are his memories like? Ina yi tuna abu da kyau in yi magana ina yi tuna ko mantuwa na zuwa cikin ko kuwa how ya is he having delirium wadansu cikin maganganun shi ba understanding cikin
na gane
ba understanding cikin maganganun shi
na yi doko magana ya kai wani wuri kaga ya bar wannan magana ya shiga
wani wuri ya wadansu kuma ma watakila wurin shanin bolin su bai kama bolin shi. You know, kami duba no kaga kaman boli ya saki mai maybe dole shi dai a sa mai diapers, you know, and all of these are general signs and symptoms. Kaga kaman ke da kankan ka duba me shi kaga there is a general decline in his ability, in his function, in his activities of daily living. Abubuwa simple things dai kamata yi dai cikin rayuwa kana gan kamar akwai sakiya cikin.
So mu duba game da rehabilitation strategies. What are some of the rehabilitation strategies for managing frailty?
Okay. Inde ya sunan shi inde da mu duba rehabilitation strategies for managing frailty. We have to look at in it in broad sense. We have to look at it in terms of the physical, the mental, the nutrition, you know, and the social aspect of it. You know, actually physical in them, the rehabilitation strategies in them, because for old people, old age in them, Bama requires so much of them. Bama requires so much of them in terms of achikamang. Oh, yeje jogging, ko ye tafi a long distance, ko ye harakan da ke at age of 30 da kai. But what we require of them is one of the activities of normal activities of daily living. Yafta ye je masallaci ya komo yazo ya zauna ya ci abincin shi ya tashi kan gado ya shiga kusfa ya fita ya je ziyara ya komo. Normal activities ba da wani impediment ya sunan shi impediment. But so that can design a program for a rehabilitation program for such a person. First of all, identify his inabilities.
Okay.
For example, the tashi watching gaduni is his problem. So you train that. What are the strategies in the daka you can use? Kabari ya dai ya fara duba yanda dai ya fara zama cikin gado shi da kanshi. Watakila method in da ke use ya tashi ya zauna nan, that is problematic. Ko kuwa watakila ma jikin gadon shi ma ba abin da dai ya kama ya tashi ya zauna. So you have to look at that strategy. This will help still maintain to be able to do that. Another strategy is that kaduba test for the muscle strength. Actually, muscle strength ya karfin muscles in shake. Lose muscle bulk in shine. Daga abune. Then you build the muscles. Akwai simple exercises you can do to build the muscles. Even as something as simple as this.
Akwai wasu videos. Inshallah. Sure. The rule of physical therapy in combating like frailty.
Yeah.
Videos.
She said the physical therapy is extremely important. Taking care of people who are becoming frail or in frailty, because most of the majority of the issues that they have has to do with the physical decline in activity. She said, first of all, soon there are a lot of muscle weakness. Physical therapy helps to build in their muscle weakness. Soon there are a lot of joint pains. The physical therapy will help to take care of their joint pains. They will have joint pains, they have back pains, they have neck issues. So now there are a lot of stiffness and the tightness of their muscles to help to relax all those muscles. Those are the rules, the important rules that physical therapy they play. And those ones need to be very consistent. Once you put them in a program, you need to do it consistently over a period of time. Set goals that you want to achieve. Then you set goals, he should be able to walk this distance. Without really getting tired. Physical therapy is extremely important, yes.
Wow. So, Masukallo, muna so mu gwada muku wasu videos game da therapy na. Amma inshallah da mu je dan gajeren hutu inshallah mun dawo za ku ga wasu videos da muke magana game da su.
It is hard taking care of your loved ones after stroke or other neurological conditions such as spinal cord injury. It's even harder carrying them for therapy every day. So, why not let us take that burden off your shoulders? At City Physiotherapy and Rehabilitation Center, we offer a one-stop nursing and physiotherapy care at our state-of-the-art facility. Whether it's stroke rehabilitation, physiotherapy, sports injuries, massage therapy, pediatric rehabilitation, acupuncture, or chronic neck and back pain, City Physiotherapy and Rehab Center is your answer. Our caring, committed, and passionate therapists, nurses, and administrative staff are always on call to give you an excellent and quality health care towards recovery. You can find City Physiotherapy and Rehabilitation Center at Kasua 2nd, just opposite the UMB Bank. You can also call us on 0269 782 200 or 0503 403-263 or 0596-036-499. At City Physiotherapy and Rehabilitation Center, you come in a wheelchair, you go back home walking. City Physiotherapy and Rehabilitation Center.
Relieve pain, restore function.
Masu kallo barkanmu da dawowa. To kamin dai mu je our break, I told you akwai wasu video da zamu nuna kan screen insha Allah. PT Miss Bao zai muna bayani kan video. Mu je mu duba video.
3, down mama 4, down mama 5, down mama 6, 1, score, yes, up, 2.
To, ga video na zaka iya kai muna bayani kai.
Yeah, so shi sa kaman yanda muka yi magana akwai rehabilitation strategies in that can use ina son duba with the physical therapy aspect of it.
Okay.
Kai wadanda ke da frail conditions ko old age, a lot of the time exercise na musu difficulty. So they want kace me shi yayi exercises, but ya kamata ka prescribe exercises in the zaman to appropriate to the person.
Okay.
She said so they were mutane ya kawo takala me shi na da knee problems. She said knee problems na kace je long walk na ya kawo mai a lot of problem masala dewa. She said these are some of the few exercises that they can be able to do. These exercises involve anayin shi da kafafuwan. Kuma in ka duba video nganga the group of sunan shi so for fee, most likely in an old age. Kinsan bamu da shi dewa cikin Ghana ma kasan tura suna da shi dewa ana gama su together just to do activities in annual activities in kasa suna zaune. Wanga what are some of the benefits in the mishi dai samu cikin ya bar heartbeat in mishi heart rate in shi je bisa kadan appropriate.
Yanda suke zaune ma suke daga hannu da sauransu ga suna
benefit from it. Suna benefit from it cardiovascularly.
Okay.
You know, ina tanya wurin fucin su, ina tanya wurin heart su, ina also ina tanya ma cikin muscles su, also in their joint. At the same time, this exercise is also not harmful to them.
Okay.
By in the kind of exercise ni shi ya kare di fara jin ciwon jikin shi ba exercise da dai yayi appropriate for the age. Domin kamar yadda muka yi magana tun farko na body nan ne ka move. In ba ka move ba basala da yawa ya zo cikin jikin. In ka duba waɗanda ake ba su kan gado shi na kwanciya bai yin wani haraka na shi ne dai a juya shi a tada shi bai dade wani ka gani ya fara samun stiffness, ya develop other complications. Shi sa wanga exercise just to try and maintain them as much as possible.
Gananga masu mimike kafafu.
Gananga su mimike kafansu, to stretch kafafuwansu, su daga annayensu, su yi dai su mummusa jiki dai yanda ya kamata.
Ga wata tsohuwa kuma.
Ga wata tsohuwa kuma kaga kaman tana move the knee joint, tana move the ankle joint and all of this. These are exercises that
ba shi ainihin su saya su yi ba.
Ba sai ainihin su saya su yi ba. Amma me shi yayi zauna, me shi da kanshi yayi da kanshi daga gida yayi duba ma videos like this yayi ko ya need an instructor ya help shi daga gida ko caregiver ma ko relative ma kuma help but before ka fara any exercise dey na da consult doctor and kade, but because most of these cases no so na the other underlying condition maybe in the shoulder pain in the knee pain she would aduba select which of the exercises that are appropriate, which are the exercises in the day body
know that
exactly she said those are kagani doctor they ko kagani the therapist they one is to screen the person farko di kama these exercises are okay mishia may cause further problems maybe in terms of injury or anything like that. He said those are for safety precautions. Otherwise, generally these exercises are very good. So they were soon as on basu. Exactly. Sometimes what some exercise when I need weights, go dumbbells. You don't back I need anything special. Go simple material and the meshiki kiriki the shi. Come on, bottle of water, ko can, ko anything that they use as weights. The exercises. Answer my what a killer maybe in Kaduba aging, what a killer in our 90s, what a killer. Ama in a what killer tashi woman is a problem. Ama in a train in a day tashi. So you say okay. Still in the abilities in the day wouldn't swan up body you maintain jikin kuma you maintain activities of daily living
ba ci kawai me shi ya sufa shi ya rauni a bar shi
kawai no ya kamata yana da wani karfin because still mutum ne indai Allah bai cire rain me shi ba mutum ne ya kamata yi move ya kamata yi rayuwar shi har lokacin da Allah the karbi ya sunan shi ran shi sa rehabilitation yana these are mostly home rehabilitation da ake yi musu daga gida amma kuma me shi ya je a rehabilitation center for some of these activities to be done for the person ma activities in ga da kike kaka duba shi kaman banza ne akwai benefits da yawa da me shi dai samu over a period of time in ka bar me shi ya decline shi sa gara dai kana ita mai akan kadan ko ka bi da wanda ke da is a specialist in the day in a guiding ko as to how you should be but most of these ones are very simple ones
wulga hannunta
yana take wulga
ta so dokan wani abu za ta yi ta
doki because inde me shi be move ba stiffness ya set in muscles yayi kanana jointing be moving in the kamata so all of these things are very very important exercises that after 70 after 80 especially in Mish Yafara decline Yafara become frail in their condition we need to engage them in some of these physical activities they are extremely important ba mu ce kaman domin su sun zama turawa wannan sun fi mu shi sa mu kuma ba mu yi irin aka kuma daga gida domin so diwa kaga kaman sofo na gida kowa na duban shi kaman sofo ganga da karfin shi na zuwa kasa shi a bar shi aka bai kama domin in karfi shi yazo kasa ina zo ne guda bai yi komi bai tashi ke ka bar aikin ka ya kamata ka zo ka zauna
isa kamar yanda suke yin ga aini akwai specific people da sunan an training su kan irin wadanga ababen da za su assessing su
shi sa cikin physiotherapist ma akwai geriatric physiotherapist da su aikin su suna duba masu sofofi mutane ko geriatric sofofi mutane da she said that's what they do, that's their area of specialty. Normal physiotherapists can do, or even a trained person, a trained nurse in the case or or even you as a caregiver. You can educate yourself on some of this because by rocket science money, these are simple things you can do. But the only thing is that maybe because me she girman she has JBs and coming kafara can me advice. Damo fara exercise aka yayi she doctor ko physiotherapist na ya duba ya screen the person kama be da wani any underlying health condition da in ya fara dai ya dame shi kuma watakila maybe in me she fara na how many minutes they have to do kaka je kana sofo mutu ka jashi te 30 minutes zuwa 1 hour manga 5 minutes 10 minutes 15 minutes and
carry. Bagabadia no da jika we afara bakwenda nake ce akwai particular person da shede ya assessing su tukuna isan kaman wanga me shi zai yayi wanga ne me shi bai yayi ko dai
appropriately ya kamata ka assess me shi sannan shi sa kamin ka fara dai doki me shi ka kai to the hospital ka doki me shi ka kai shi to see the therapist sai babana umma na ta fara samun weakness tana zaune ba ta komai ba ta move mu da kan mun kaman tana decline in her strength sande the therapist the doctor in yayi assessment da me shi ya check blood pressure maybe be the high sugar me shi na da normal be the underlying what heal a heart condition be the joint stiffness or pain or the pain is not so much. She said, okay, all of these assessments I can do. And she oh, wanga de ma ta fara exercising gangangadi be damunta. She afara. She said maybe a first few sessions in the can the therapist to help you and guide you. The rest she back at home exercises kida kanta ka supervise me she ina in the gida.
Kokwa so guda ka gani.
Exactly. Kokwa kama in a case of us like City Physiotherapy and Rehabilitation Center, for example, Muaka, what we able to do is I'm gonna take in these people, let's say for a month.
Okay.
You know, for a month, we switch some of these programs for a month. She said, what killer maybe in Tashi watching Gadone is our my problem. You know? After 1 month in the moon train me she kadan Aria ina Tashi zauna ko kuwa maybe inda ya tashi ina zaune sayawa ni be ya saya within a month in the moon training me shi kadan ba gidigidi ba akwai technique na damu use kadan so tafi sai ya tashi ya saya inda wata kila tafiya ne be ya yi tafiya da kin yi tafiya akwai risk kamar ya yi fadi ne shi mu training shi kadan are inda dai ya yi tafiya nzima frame ne dai rika kadan ne shi ya tafiya ko kuma muka gan kama ma yana use zima frame amma yanzu mun training shi ya graduate shi mu bashi itace ya rika ko kuma muka assess muka duba muka gan kama oh be need ma itace ya yi tafiya mun training shi up to that level ko kuma maybe yana tafiyan shi short distance ne ya gaji. But maybe after a month in the more rehabilitate the person, we improve on his cardiovascular fitness. Means yeah, it a long distance. After a month, she will discharge she will body zogida. She will advise come on you continue on this program that he has.
Wow.
She's a longer program on an intermediate care program. Domin psyche are very important. Yeah, very important. Domin can safeguard take time on kada kudinka. Ka safeguard helping babanka ko ummanka kaga zauna kace kaman ban sani abin da din yi ba sufanci ne kawai no dan shi bai deserve ya kwanta domin kwanciya akwai wahala cikin
ba easy bane
kwanciya akwai wahala cikin
wani bin kai kwanan dare ma kana Allah lagarewa ya ka tashi
domin in juye wani mishi ya kira kaka juya shi in dai tashi yayi ya je shiga kusurwan ya tashi ya kira ka inda tashi cikin gado ne inda yi wanka ne ya zo kan wani lokaci baka duba ba shi dai ka bida mai fullness yazo zauna kusa da shi 24/7 so to take care of their needs inda ke baka ya ka samu lokaci ka zauna shi sa prevention is better. Prevention is better once ka gan kaman wanga frailty ko sufanci hausanci nan ya fara shigowa cikin what can you do to slow it down to stop it or to minimize it extremely important. Nka bar shi is at a cost to him and it's at a cost to you as well.
Ka da cikin Arkana therapist ina so mu sani are there any specific program or intervention that have proven successful in reducing frailty now?
Yeah, programs, very much as long as ka seek for intervention. Every case is different. Every case is different. It's by case by kuma one case the severity. She said once you assess the patient, you can design a good program for that person. Most of the time, you can have more success in rehabilitating the person back. Wow. Especially in the bar, so much of an underlying condition that is limiting the person from going through the program to get the person back to function. Yes.
Wow. Akuma Masayinka kuma deputy chief na physiotherapy Kwalebu Teaching Hospital. Ka kuma dade cikin aiki na therapist. Zaka ka ba mu wani successful story game da irin wannan ko personal story irin wannan.
So in terms of success stories, they were because every day you come into contact with patients. Okay. Yeah, and sometimes maybe the joy the chicken tuban patient ne shi ka duba kuma wangan ganga shi farko tafiyan shi na the problem. Okay. Gashin zuwa na tafiya fine ba da wani problem ba. She said, as for the success stories, and then they were both at Kwalebu Teaching Hospital, the city physiotherapy and rehabilitation.
Bamu wani gudanda viewers mu dey motivating so na da so for figida an ba su kan gado an ba su cikin kujera ba therapy ba komi uru guda dey ana fama da.
So there is this particular one that the person has to happen to be actually even a friend. So the person called me. It's like so funa rauni ya fara zuwa. Okay. Rauni ya fara zuwa tafiyan shi da baba yana tashi yaje masallaci yayi komai da kanshi. I think there was after the death of his wife. You know, sometimes some of these things, bayan they go through a stressful period, it affects them. Okay. So after the death, after a few days after funeral, Harokoki Yazu, I guess were up and down. Akakari, no, Shishukuma, then he came down. So Zamama for a long time was becoming a problem. Mostly he was in bed and all of those things. Then he called me. She said, when we did that, so in our center we have a rehabilitation team. Okay. She said, the farko is on. So what we did was that Moon take him through the test, run the test. We can check his blood pressures. I can take labs. I can check to see. I can run X-rays and all those tests that we need to check. Say, back home the kisamunshi. Just that, I think he's just having issues with his muscles and with weakness setting in. There was no reason, but he came. Center for a period of time. Baba has gotten back to his feet. He's walking, and he's gotten back to doing what he used to do. She said sometimes it's about you, the relative, observing it and catching it earlier and seeking the help of health professionals that can help you, that can teach you and show you what to do. Sometimes, because the most important thing is that in Kabarshi, the consequences is exponential before I realize so
Baba is fine now. It's fine now. You see, da ba don ayi wannan intervention nan da kawai an bai shi shikenan ce ya sufa ne shi kagan baba kuma na zaune.
We are talking about somebody who is 83 years old. Wow. We are talking about somebody who is 83 years old. But he's gone back. He's walking, though he's using a stick and walking. But he's got.
Garadi haka da wanda dai saura cikin gado ko cikin wheelchair ana fama da shi yana kallo da na samu na tashi yi kaza na samu na tashi yi kaza bai yayi shi dai wani ya shigo ya taimaka mai.
Basic things in the shi da kan shi dai harakokin shi. Yeah.
So what are your advice to our viewers?
Yeah, so the advice to our viewers is that we have all section of viewers. We have the young, we have the old. Your young one, let's take care of ourselves. Let's engage in physical activities and physical exercise. Let's build our muscles. Very important. Okay. You know, after the age of 40, 45, you are in decline. You lose your muscle mass. Okay. It's not like before. She said, lift a lot of weights. Run a lot to maintain your cardiovascular fitness. Okay. Eat good food. Don't eat just anyhow. Okay. So after your the unlucky after 60, after 70. E kai 80 ma kana tafiya kana harakokin ka yanda ya kamata. So if you're able to take good care of yourself at your early stage in life, later stage in life, things will not be so difficult.
Okay.
The people who are also old, Sukuma, there is no loss of hope. There's no loss of hope. There are a few things you can do to still maintain your health. It's okay, activities of daily living. Kakai saura kana kwanci cikin gado kana zaune wuri guda.
You can start something.
You can start something.
Okay.
And sometimes also maybe the motivation might also not come from the person himself, but it also has to come from the relatives, the children. They need to talk to the father or the mother, motivate them.
Okay.
Motivate them to get back to being active.
Okay.
Sometimes also maybe because there's something that is worrying. Maybe in your father grew. She's a karmu force sukachi dashikaita fia kun lokachi kana zone back. She said that's why you need to send the person to the doctor, to the therapist to assess what is the reason why they are not being active.
Okay.
So we need to look at all of those things. So in short, let's take care of ourselves, whether we are young or whether we are old.
Okay. Akwai wansu masoyan da zaka musu gaisuwa ya so mu wrap up.
Yeah, first of all, the Nasun Gaida staff of City Physiotherapy and Rehabilitation Center. Muna located like a Kaswa second opposite Pinkefren. Last Sunday, the Mukita Magana, most of them are actually watching us. Nasun Gaida, my immediate family members, my father, my mom, my wife, my children, all the people around me. I just want to say hello to them.
Okay, lovely. This brings us to the end of this topic, frailty in old age. Aya inda mutum ke rauni, weakness kenan yana girma. Wani ma bai kai a ce aging shi da irin raunin shi ya kamanci ba. A'a, shi kaga age ya fi a ce yana da karfin jiki amma ya fara rauni. PT Misbawo ya muna fira wani na mutum ka relax ne wasu ababen da fika yi kamar exercise da sauransu. He mentioned a lot. In kana yin su insha Allah zai ya kawo maka sauki. Ka kumanta City Physiotherapy and Rehabilitation Center are our proud sponsors. Da ka locate su daga kasuwa opposite Pink FM da kuma UMB Bank, right?
Yeah.
Sana you can connect with them on 0269782200 0269782200 Sana 0596036499 0596036499. Njisu way your health our priority. Ni na gabatar muku da shiri na Amina Muhammad wanda ni da shi muka yi fira bako mu kenan PT Misbawo, Deputy Chief ni na Kwalebu Teaching Hospital da kuma shine CEO City Physiotherapy and Rehabilitation Center. A big thanks to my production team members. I love you so much, Mahuko and Sami, and also Programs Manager Malam Farisan nan Ajia Rashida Ibrahim, Magajiamo Kina. Salam alaikum viewers, thanks for watching. Bye bye.
It is hard taking care of your loved ones after stroke or other neurological conditions such as spinal cord injury. It's even harder carrying them for therapy every day. So, why not let us take that burden off your shoulders? At City Physiotherapy and Rehabilitation Center, we offer a one-stop nursing and physiotherapy care at our state-of-the-art facility. whether it's stroke rehabilitation, physiotherapy, sports injuries, massage therapy, pediatric rehabilitation, acupuncture, or chronic neck and back pain, City Physiotherapy and Rehab Center is your answer. Our caring, committed, and passionate therapists, nurses, and administrative staff are always on call to give you an excellent and quality health care towards recovery. You can find City Physiotherapy and Rehabilitation Center at Kasua 2nd, just opposite the UMB Bank. You can also call us on 0269 782 200 or 0503 403 263 or 0596 036 499. At City Physiotherapy and Rehabilitation Center, you come in a wheelchair, you go back home walking. City Physiotherapy and Rehabilitation Center.
Relieve pain, restore function.